If your X-ray, MRI or CT scan is showing simple bone cyst or unicameral bone cyst, then what does that mean? This simply means that some part of the bone in your body is having a cyst or a tumor-like thing, but it is not a cancerous thing, so don't worry. Normally, simple bone cyst or unicameral bone cyst happens in this part of the body, that is near the shoulder area, upper part of the arm. But it can also happen in areas like pelvis, spine, or sometimes in the heel bone or bones near to the knee joint. So this is normally seen in age group of less than 20 years and it is more common in male patients. But if you see, normally this is not diagnosed unless there is a fracture. That means most of the time this cyst gets observed or comes into attention only when there is a fracture and we do a X-ray to diagnose the fracture. Then we come to know that okay, this fracture is because there was a cyst at this place. In most of the situations, there is nothing to worry. When this fracture heals, the cyst also heals up. But rarely if the area is not fractured and the cyst is large and we have diagnosed it either incidentally or because of some symptom, then the treatment is through the form of curettage bone grafting. Normally that means that to clear the area of cyst, we use a special curette or we take out the disc or we take out the tumor material and we fill that area with bone chips. So over a period of time, as the bone chips get incorporated, they form a solid bone. So that way we are able to get rid of the cyst. Rarely, sometimes we need to fix this area also if we are expecting a pathological fracture or if already there is a fracture. Now fixation can be in the form of a nail or a plate that we need to put to stabilize this fracture. So if you are suffering from unicameral bone cyst or simple bone cyst, don't worry. Normally it will not bother you. If at all there is some fracture, it might require a fixation surgery. But in majority of the cases, no major complication happens because of this cyst. And it is an incidental finding that we come to know if at all there is some swelling in the proximal arm or sometimes pain or discomfort. But most of the time it goes unnoticed and the diagnosis in itself is because there is a fracture somewhere, someday. Thank you.